Welcome to an all-new episode of Hatching for Health, where our mission is to create a platform for people to tell their story, to educate the public, and to build a more compassionate community. Today, we're excited to hear about the new advances in IVF and fertility treatment from fertility experts Megan Watier, Chris Axelrad, Suyhun An, and later Tasha Blasi will join us via Zoom. So, welcome to the show, Megan.
Thank you so much for having me.
Yes, I have been a patient of yours personally and just had amazing experiences. And due to the fact that I'm on my own IVF journey, I was like, what better fit to have her on the show along with a few others.
Yeah, so excited to be here.
Yeah, so tell us a little bit about your practice.
Sure. I am Doctor of Chiropractic by trade, and my practice is primarily preconception, pregnancy, postpartum, and pediatrics. And then I realized in 2019, there wasn't a lot of preconception care. And so my practice, Momentum Health, is in Katy, Texas, which is just West Houston. And so I reached out to Dr. Mercier in Chicago, and I was like, when is your next training? And so I went to Chicago for my Mercier therapy training, and I brought it back to Houston. So Mercier therapy is a deep gynovisceral manipulation of the pelvic organs. So it's a very deep massage, like, of the reproductive organs.
Right. I mean, I actually personally experienced this, so I know exactly what you're talking about.
Was it comfortable?
In the beginning, not so much, right? But Mercier therapy is the name of this, right?
Correct.
And it's this additional, course that you have to go and take and, pay in addition to your chiropractic training.
Right.
And be certified, because I know there's not a lot of you guys out there that do this.
There's not. There's just a handful here in Texas.
Wow. Yeah, I forget who had connected me with you, but it was somebody that was like, oh, actually, it was Dr. Jung and his wife. That's right. Yeah, so they were telling me about you. They're like, one of our friends, went to her and she conceived, and, I don't, whether it was IVF or naturally, it's, because that's the thing, is what you're doing is from either natural conception to the IVF journey, like both. So tell us a little more. So, because I experienced it personally, but the deep tissue.
Exactly. And so a lot of women with endometriosis, PCOS, or even secondary infertility, so a woman who has had another baby, but then from the scar tissue from a C-section doesn't allow for proper blood flow to the uterus anymore. And so there's a lack of mobility. So Mercier therapy goes and breaks up that scar tissue and the adhesions to allow for better blood flow for implantation again.
It's incredible.
Yeah.
Yeah, and it actually, once you get into the treatment, it feels good.
It actually, your body craves it.
Yeah, like I, was coming to you basically, in the beginning it's like every other week, and then it's kind of like the, what do they call, just keeping up with the treatment.
The maintenance.
The maintenance, it was once a month. But it's not just, you're also, you're having a turnover and you're doing it along the caucus. Talk about how all those basically connect to your uterus.
So the uterus is deep in the pelvis, and we have so many ligaments that actually hold up the ovaries and the fallopian tubes and the uterus. So if we lay a woman on their side, the intestines can get out of the way, so we can go from the left side of the uterus and the right side. And so when you lay on your belly, the uterus actually attaches to that sacrum, which is at the very bottom of the lumbar spine. And so if there's lack of motion of the sacrum or all the muscles that attach there, so we had to work on those glute muscles, which isn't very comfortable.
Right.
So if that's decreasing sacral mobility, it's decreasing mobility in that uterus as well. And so it all just ties in so beautifully.
I know, it's incredible. Like, I mean, for one, what it's done kind of for me, and the different retrievals I've had with IVF, like I've actually noticed that I've had less pain, like following the retrieval, for reasons connected to, I would believe, to be Mercier therapy.
Yeah.
So I know it made a huge difference in my life.
Which makes me so happy.
And so people are coming to you from not just Katy area. I mean, you're getting people coming from all over.
All over. I've had people from, I think, Cleveland come, and then even just north of the Woodlands. It's just because there's not a lot of Mercier therapists in this area, and I just feel honored to be one of those providers to help people on their fertility journey.
No,
and it's not just the sessions, like you mentioned, the maintenance. I follow up with my patients once a month, like, how are your vitamins? How are your retrievals? How's your mental space? How's the relationship with your significant other? All of those things, because it plays such a role in conception.
You're like a therapist as well. So with the chiropractic side of things, because I also obviously always got adjustments, like I know there's the really importance of that too, just like alignment and stuff through, you know, with the blood flow and all of those things as well. So just tell me a little bit about from a chiropractic perspective.
So the brain is the most important organ in our body, and the brain sends messages down the spinal cord and out the nerves to all the organs in our body. So by our jobs and working out and sleeping and posture and crossing our legs, we can actually shift those vertebrae out of alignment, putting pressure on the nerves, going to those important organs like the uterus or the testes or the heart, the lungs, anything. So removing that interference just allows for the brain to communicate to those areas more efficiently.
I love it. I love it. It's a great combination that, you know, Mercier therapy is a part of a chiropractic practice, right?
I call them my golden patients, the patients who conceive Mercier, then they continue pregnancy, chiropractic, postpartum, and then it just brings tears to my eyes thinking about adjusting that Mercier baby.
I know. I see every time I'm there, you have a baby in there, and I'm like, it's just wild that, you know, there's a practice of adjusting a baby and and the things that you know, that's a whole nother conversation. Because it's like the things that
we talked about that a little.
Right. Well, how can somebody sign up?
For sure.
It's really important. And
yes. If you go to my website, my clinic name is Momentum Health. My website is www.drmeganwatier.com, and that's DRMEGANWATIER.com.
Okay, perfect.
Yes.
Well, you're going to stay put with us, and we're going to bring on another fertility expert in their own way and continue to learn more. So, and now we're going to be joined by Chris Axelrad with Axelrad Clinics. So thank you for joining us as well.
My pleasure. My pleasure. Happy to be here.
Yeah, it's like a great combination. Megan actually recommended, you know, connecting with you through all of the patients that you're treating in this fertility world. Which is a large percentage, I hear, of your clinic. But tell me first about your background and your clinics.
Oh, my background? Well, so I graduated high school, initially was a music major. My father was a physician. He was chief of staff of urology at Memorial Hermann for many years. So I never really saw myself going into medicine, but as I studied more music and studied more things, I started to become more and more interested in human potential and just how the mind and the body work together, which eventually led me into studying Chinese medicine. So that's my foundation, is Chinese medicine.
Beautiful.
Yeah. And that includes acupuncture, herbal medicine, nutrition, and, you know, mind-body like disciplines, right?
Right.
I graduated from that school, did extensive studies, even deeper into mind-body medicine, and also into functional medicine. And so at this stage of the game, I mean, since I've been doing this almost 22 years, I really see myself as a holistic endocrinologist and fertility specialist, because you know, the acupuncture is definitely a big part of what we do, because it's such a powerful modulator of the neuroendocrine system, which is how the brain and the hormone systems talk to each other.
Right.
And when that gets thrown off, there can be a lot of other things that get thrown off downstream. So the acupuncture is an amazing tool, and then we also integrate a lot of dietary supplements and herbal stuff, and also a lot of coaching on nutrition, and just really just help people create, or really they don't have to create fertility, okay? Fertility is inherent, but we just help people to set their body up so it very naturally expresses the potential that it already has.
No, I think it's incredible. And having 5 locations too, I mean, you're, you know, basically all around in Houston and then the greater Houston area. It's surrounding, like, in, I think, Sugar Land, or you have like clinics?
So we have 4 offices. We did have an office in Sugar Land, but we moved it to Pearland. So we're in Pearland, Katy, Woodlands, and then right near Memorial Park, basically.
Okay.
Yeah.
So predominantly, people are coming to you like for holistic, you know, medicine options, and acupuncture is one of the main tools that you guys have there. Okay.
And supplements and herbal medicines. Yeah.
And herbal medicines. Okay. So with the, you know, women coming in from an fertility perspective, like, what percentage of your practice is actually for that?
Well, I would say that for me, it's like 95%.
Wow.
Yeah. And then for my associates, probably upwards of 70 to 80%. I mean, we're pretty much all fertility. We also do help women who are going through perimenopause and menopause, which happens to be a lot of our patients that we help get pregnant 10, 15
early on,
years ago, right? But people also refer to us for that. PCOS is a huge thing that we see a ton. People who aren't necessarily trying to get pregnant, but they have this hormonal imbalance. They don't feel well. Their cycles are off. They're being offered birth control, metformin, other drugs. Maybe they've tried those drugs and they just didn't work for them, or they just want to try a natural approach first that's going to address the root. So we see a lot of those people as well.
Of course. So with a fertility treatment, what is kind of a standard, you know, someone coming in, like how often are they going to be coming back if they're doing like an IV, sorry, not IVF, well, maybe they're doing IVF, maybe they're trying naturally, but if they're coming in for that ongoing acupuncture, is it a few times a week? Like how often is someone coming in?
Yeah, so the way we work is typically we see people once a week. We know that people are busy. Houston is a sprawling city, you know, traveling can be difficult. We don't want to add stress, right? That's the last thing we want to do. And acupuncture is very effective. The treatment doesn't just wear off after a day, right? So we build momentum by doing once a week. And for the people that we see that are trying on their own without any kind of assisted like IVF or IUI, the sweet spot is between the 3rd and the 6th months when most of them get pregnant. Now, not everybody gets pregnant, okay? We get to that 6-month mark and someone's not pregnant, they can choose to continue because people will be able to tell that their system is improving, they have better energy, better sleep, their cycles, you know, the pain during their periods, a lot of times the ovulation becomes more obvious, things like that. So a lot of times, even if they're not pregnant after 6 months, they will continue for a few more months. But I'm always ready and willing to have the conversation with them about, hey, you know what, maybe you should try IVF, maybe you should try this. And the good news is people who come to see us, by the time they're gonna do IVF, if that's something that they end up needing to do, it's like we've got them in shape, you know?
Yeah, you've really like balanced everything out.
Yeah.
So they're completely ready. Well, so where can somebody, you know, find you guys? Is it axelrad.com or where can someone come and, you know, call in, get an appointment?
Axelradclinic.com, which is spelled AXELRAD. Okay. That's a key. Yeah. And then clinic.com. That's where you can find out all about us and, you know, read articles that I've written and just learn everything about what we do.
Amazing. Well, we're going to keep the conversations going. I do want to bring on our other guests, Dr. Suyhun An, who I know y'all are both familiar with as well. So let's bring on Dr. Suyhun An. So Suyhun, it's so good to have you here.
Thank you for having me.
You've become a friend of mine. You were my neighbor for a little while until I moved.
Yeah, all by chance, by walking on the street.
So tell me a little bit about your practice, because I've actually been a client there, a patient there myself. So I know a lot, but share with the audience.
So my clinic is called the Campbell Health Center, and we take care of patients with the chronic knee and back pain and joint pain and numbness and tingling of the feet using regenerative medicine like plasma therapy, stem cell therapy.
Amazing, which is unique, I should say. The fact that all the things that you're doing, which I know IVF is and fertility is kind of in a corner of that. There's a lot of like controversy over what works, what doesn't, what's a part of someone's success. But what you're doing in general drew me in, just because we think we were talking about some of my family needing stem cells for some of their aches and pains. And that's how I kind of got introduced to your clinic, and they've had some success personally there. But so tell me, with the different stem cell options and there's other you know types of injections you guys do, like steroids as well, right? So tell me, what kind of clientele is that, you know, predominantly?
Most of my patients are working patients. A lot of them have to depend on their body to make the living and support their family. A lot of them are also newly retired patients who worked hard all their lives to enjoy their lives, but they can't because their knees hurting or their back's hurting. And a lot of them are also told that surgery would be their only options to get out of that painful condition. And they want to avoid having to go through invasive surgery and having to go through a very long recovery time.
Of course. Yeah. So with the stem cell options that you guys offer, is that, I mean, I guess it's not kind of a one size fits all. These are for different areas of the body.
We treat, I don't know why, knees and back the most. Okay. And people that are suffering from numbness and tingling, most of them from diabetic neuropathy and what we call metabolic syndrome. But we have used them to really head to toe, from hair regrowth to facial rejuvenation to sexual enhancement in a form of, he shot and she shot is what we call them. Yeah.
Okay.
And but that is an outskirt of what we do. We primarily focus more on orthopedic chronic pain type of condition.
Right. And so I think with you being on the show, obviously, as much as your practice does amazing things from the fertility expert or from the fertility side of things, I think what was special is I met you and I learned that you basically have 2 little children via IVF, and you had kind of talked about some of your backstory to that. So tell me a little bit about that, because I know that there was a trip, even outside the country.
Yes.
A little bit.
So my mother was having a lot of health issues, really declining health back in 2019, and through my network of doctors and clinics, I have a relationship outside of the country where patients can receive a very large dose of stem cell therapy. So I took my mother there, and while I was going there, I told myself, well, I'm taking this long trip outside of the country, and it's good for me. It's anti-aging. I can't get pregnant. Why not get myself some too? And I came back and I told myself, if I don't try IVF one more time, if that treatment did anything, I'm just gonna regret it for the rest of my life.
Right.
So I did one more IVF treatment. Before, I was struggling to make 1 or 2 embryos. After the stem cell therapy, I ended up making 5, and we transferred them, and I ended up with a healthy pregnancy and a baby girl, and I was almost age 46.
Wow, that's incredible. So you went along with your mother there, and then, so tell me, so did you do any of the stem cells yourself?
Yes, I had been struggling to get pregnant and have a baby, multiple failed IVFs. And while I was taking my mother there, well, it's anti-aging, it's good for you. So I got myself the same dose, which is 200 million stem cells at the same time. And
Wow, okay. So good for you. So you actually did that as well. Okay, so I want to hear more. We do have to take a commercial break. We're going to learn about what that did for you. So we will be right back with you after this commercial break. But before we go, I did want to share a little bit with the audience about Hatching for Health Foundation and what we've been doing in the community. Last week, we were able to give Ashley and her family a beautiful memory at the Pumpkin Patch After Dark with the Big River Amusement Park due to the generous donation they gave us for the Pumpkins After Dark event. And here are some clips of Ashley and her family.
No one plans to be in an accident. Big truck wrecks, car wrecks, and drunk drivers can cause catastrophic injuries, brain damage, amputations, and death. These cases require aggressive, tough lawyers. With over 100 years of experience, Thomas N. Thurlow and Associates will fight to get you what you deserve. There's no upfront cost, no obligation unless we win, and you pay nothing out of pocket. Call today to get the justice that's owed to you.
In 2020, I was going to work and the stairs of my apartment broke, and I went 20 feet through, breaking my back in 2 places and 5 discs herniated. I was scared, alone. After meeting Dr. Remy Nader and his staff, it got me back to not only the dad I used to be, but the person I used to be too.
At the International Center for Neuroscience, we take pride in providing you second opinions for your brain or spine problems. I'm Dr. Remy Nader, board-certified neurosurgeon. Let me help you get your life back.
Your private practice deserves more than sticky notes and missed calls. Funnel Cake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnel Cake MD. Start your free trial now at funnelcakemd.ai.
Funnel Cake MD, all in one tool to grow your practice.
Welcome back to Hatching for Health. Before commercial break, we left off with our 3 fertility experts discussing IVF and fertility treatments. So we are back with you guys, and we're going to have Tasha Blasi join us soon. But let's get back to the story. So you went ahead and did some of the stem cell treatment there as well with Mother, and then did you do IVF again when you returned?
Yes. So I signed up. I mean, I was visiting doctors outside of Texas who specialize in older women. But it was just something that I had to just try one more time. So I went to a clinic locally here in Houston and tried one more time and made 3 embryos, and one of them stuck, and I have a beautiful baby daughter now. I mean, she's 5 years old now, but.
Amazing.
Yes.
And that was at what age did you get that healthy embryo?
The embryo was formed about when I was 45. And the baby was born a month before I turned 46.
Wow. Amazing. Yeah, that is incredible. And I mean, I think it's something, I know that that's not your focus of your practice, but those resources are also here as well.
Yes.
And so whether people, want to use them for that or just overall well-being, that is something that you guys offer, right?
Well, it's not, I wouldn't say that it is something that I offer, but I guess word of mouth, online communities, people may make a comment. I have become friends with 3 women who are all well into their 40s who got the same treatment that I did, and we're all parents now. Yeah. So words gets around, and here and there, it's weird, in my Telegram app, I would just get messages from people from all over the world, really. One woman was from Jordan, Chicago. I just heard about you from so-and-so, and is that something that you can help me with? That's pretty much the extent of, my help with fertility. Right. I'm here more as the consumer who's done it all.
Right.
Versus a doctor who provides that treatment.
Right, uniquely, you at least can speak on it more,
yes.
properly, being that you are a doctor and kind of understand that world a little more. So we're going to now bring on Tasha Blasi via Zoom and kind of hear from her, and then maybe kind of open it up to some questions collectively. Now we're welcoming our IVF protocol and execution specialist, Tasha Blasi, who has helped guide and support countless women since 2016 through their journey to successfully having a baby. So Tasha, welcome to the show.
Thank you. Thank you so much for having me.
Yes, I additionally personally had some experiences in calls with you, and before that it was me listening to many podcasts of your stories of yours, and very impressive. So just tell me a little bit about what made you start this podcast.
Yeah, so I did 10 rounds of IVF myself, but I was 33, it was a male factor, and that's not what got me started to do IVF success consulting. And honestly, if someone's like, hey, I've done 10 rounds of IVF, let me give you advice, like run. But what happened was, after my 2 children, somebody else had the idea for me to do really fertility coaching. And that was in 2016. And it's just evolved over the years into really figuring out what helps somebody get and stay pregnant, whether doing IVF or not. But my specialty has become IVF protocols and executions. And so I would say starting in 2022, I've worked with doctors. I got all my research of thousands of protocols together, and I cracked the code to figure out the formula to IVF success. Perfect protocols, exact executions.
Right, and I learned quite a bit, even like throughout my IVF journey personally. It was things that, maybe I was doing wrong, questions I wasn't asking the doctor. I think you really tee someone up for the success, giving them like that knowledge they need to go in there, because we're also naive to like, well, the doctor says this, we do this, and sometimes there's like, okay, well, maybe if I ask this question, my protocol would be a little bit different. So tell me kind of about that and the guidance that you give.
So the first thing I do is a deep dive on kind of what everything looked like. I have found that the same protocol that I did, right? My son's 16 years old, so 17 years ago, is the same protocol they're doing today with high egg reserve, low egg reserve, PCOS, whatever. And I call this cookie cutter approach to IVF, or okay IVF versus optimized. It's never going to work as well as customized protocols. So the first thing that I do is I study what the doctor does, right? Especially if they're sticking with that doctor, to come up with strategic little changes. And I show them in their monitoring reports where these little changes could happen to optimize their results. Ultimately, I can tell somebody's perfect protocol. There's always different ways to do it, but like in general, by data points, their age, FSH, AMH, follicle count, BMI, menstrual cycle. So that gives me a foundation. But then, because doctors don't want to be told what to do, I get that, I go in there and show them what questions to discuss with their doctor, what strategies is their doctor willing to do or not. The questions are always kind and curious, like, hey, what do you think of this? What would you do to create more even follicles? What would you do? And then we just, that's how we approach the doctor. So I teach my clients everything they need to know after I do the evaluation, and then I set them up with questions to discuss with the doctor. It's like a script.
Right. So tell me, you've, of course, doing your own many rounds. You actually travel around the world. You're meeting with IVF clinics all over the world and kind of understanding each of what they're doing as well, right? Like your knowledge is from clinics that you were never a patient at, but you're getting that information for, your podcast viewers to be able to, get the help from you as well.
Yes. So I am not a doctor. What I say is I've just studied doctors around the world and thousands of protocols. And so, yes, what I have put together, I find it's a great resource because it's based on not what one doctor or one clinic is doing, but what I have seen thousands of protocols doing, and what keeps on working, what keeps on not working as well. So yes, I have clients, I think Kenya, was my last country, like 16 different countries. Biology doesn't change, right? So it's just about what consistently works for each profile of a client.
Tasha, I know, where can people also find you?
Yeah, the best is to start at my website, tashablasi.com. And there's even like a quiz right at the top that will get you the resources that you need for your next step with IVF specifically.
Wonderful. Well, thank you all for being here. You've been a special part of my life, and I'm going to start coming to you for acupuncture as well.
I'm there for you.
And it's been a blessing having you all here. So thank you, and thank you, Tasha.
Thank you for having us.
Thank you.
And thank you all for tuning in to another episode of Hatching for Health. We will see you right back here next week at 9:30.